Hello, good afternoon, everybody. So I'm not going to repeat the title in the interest of time, but in my presentation, I'll refer to toxicity testing in the 21st century as TT21C. So a brief overview of my presentation. I'm going to briefly touch on Imperial Brand's harm reduction strategy. It's very similar to a lot of the other manufacturers' strategy in terms of harm reduction. I'll explain this concept around TT21C and what it means and its application for assessing ENDS products. I'll share some encouraging data that we have with our blue product. I'll talk about how we integrate all of this data in terms of a holistic understanding of toxicity data and systems biology, and finish off with some concluding remarks. So harm reduction. This has been covered by a number of speakers already in this conference, and ultimately it is broken down into three areas. So it is the exposure risk, the individual risk, and the population risk. And I've listed, on this slide you see I have a number of questions. I won't read out every single question. You'll have access to the slides after the conference. However, if you're able to answer yes to all of these questions, then in principle, you should be able to have a reduced risk product. Now, in terms of the harm reduction strategy itself, it's broken down into preclinical and clinical work. The preclinical work focuses on the aerosol chemistry and the physics, and that also incorporates the toxicology assessments, and it also incorporates clinical work and also long-term post-marketing surveillance. Today, the focus of my talk is on the toxicology assessments. Imperial Brands strongly believes that in vivo testing or animal testing is not required for the assessment of ENDS products. It believes the latest advances in TT21C approaches allows for this paradigm shift, okay, which enables testing to be done quicker, faster, and more importantly, without the use of animals. Okay, so this TT21C approach. In 2007, the National Academies of Sciences published this landmark book, Toxicity Testing in the 21st Century, A Vision and Strategy. This document has recently been updated in 2017, and it proposed a paradigm shift, moving away from testing high doses in animals to using human-derived cell lines at human physiological concentrations. Underpinning this TT21C strategy, or this TT21C approach, is this concept of an adverse outcome pathway, or a toxicity pathway. And it looks at the cellular responses that are perturbed or disrupted that lead on to disease progression. Okay, so taking the diagram here, what we have is the source. Now, this can be a drug, it can be tobacco, it can be any foreign object or foreign compound. You have exposure to your biological system, which then results in some form of cellular activity. That may be a perturbation. Now, that perturbation may lead to further cellular changes and move on to cell injury and morbidity and mortality. Or we also have compensatory mechanisms which restore normal biological function. Okay? So this is fundamentally the theory behind an adverse outcome pathway or a toxicity pathway. And the significance of perturbation will depend not only on the magnitude of the individual themselves, but also on their genetic predisposition and their disease and life stage of host. So, toxicological assessments. If you've had the pleasure of speaking to toxicologists, or the displeasure for that matter, they like to talk about a weight of evidence approach. Okay? And essentially what that means is taking together small pieces of a puzzle and formulating a much bigger picture. And essentially this is what the TT21C approach is about. Okay? So essentially the arrow here in the slide denotes the increasing complexity in those different tools or those different pieces in the jigsaw. Okay? And the arrow, and as you move through this process, the in vitro assays more closer resemble the in vivo situation. So in this case, we start off with some smoke chemistry to understand what is in the aerosol. We then conduct some basic regulatory toxicology assays, which has been conducted for many years in the pharmaceutical industry. We then move on to the in vitro disease models. Okay? These disease models give us that understanding and those progressive states that then potentially could lead on to disease. We also complement our in vitro work with clinical work and vice versa. So we've conducted a number of clinical studies whereby we have taken various blood or urine samples from clinical subjects and have placed them into our in vitro assays. So, taking you through some data. Looking at the aerosol chemistry data here, we have conventional cigarette compared to one of our open system products, our blue open system. And many manufacturers have already reported a 98 to 100% reduction in some of those chemical constituents of toxicological concern. And many have already reported in the scientific literature greater than 90–95% reduction in these constituents. But how does that translate in a biological context? Well, using conventional toxicology assays, we see a greater than 99% reduction in biological activity. However, these assays are what we call qualitative assays. They don't give us that understanding of the mechanisms leading to various disease states, and that's what ultimately we're interested in. So, taking you through some work that we've conducted with some of our blue e-liquids, we have looked at a number of critical endpoints, and these endpoints are implicated in various disease mechanisms. We have exposed this cell system, this human cell system, to e-liquid at 4 hours and at 24 hours using a high-content screening method, and in this assay we see no effects for those various health endpoints. Taking it a step further, we have also used e-liquids in a multi-cell line panel system. I appreciate this slide is a little bit small, so I'll navigate you through it. So on the left here, you have a table with all the different cell systems, and the cell systems also indicate the disease state if that cell system is significantly perturbed. Okay? On the graph here, you have the gray line here, which is the control response area for that particular cell system. And then after exposure, you can see at the bottom the increased upregulation or deregulation of various protein markers within that cell system. Now you can see here in this example, we tested a base liquid comprising of nicotine on this cell system, and we also tested base liquid with flavor on that cell system, and you can see that this cell system was sensitive enough to detect various changes in this particular cell system. Okay? Again, not necessarily a bad finding, it just means it warrants further research as part of the weight of evidence approach we employ as toxicologists. Now, for me, this is quite an impactful slide, again showing data from our blue products, whereby we exposed a 3D cell system to 400 puffs of EVP aerosol, and we also used air blank controls and conventional cigarette smoke. In this example, you can see that after exposure to 27 puffs of conventional cigarette, we've got complete obliteration of the architecture here. However, if you compare to e-cigarette, both with flavor and without flavor, up to 400 puffs, you can see no differences at all. You see no disruption to the tissue morphology in this diagram here. So to deep dive into that a little bit further in terms of molecular and cellular endpoints, you can also see that it has up to 400 puffs of EVP aerosol had no impact on tissue viability. And if we look at a marker for oxidative stress, we also see no significant difference compared with base liquid and flavored e-liquids. This graphic on the right shows DNA staining, and you can see here the pink little specks here picked up by fluorescent staining, where you have DNA damage. And again, a similar story. You can see up to 400 puffs. You see no differences compared to air blank controls. So I've talked a little bit around perturbations of the cellular networks, and that's what is important in terms of understanding disease mechanisms. And in terms of animal studies has to date still been the gold standard with respect to understanding safety and efficacy of normal, say drug chemical entities. However, I often refer to this black box, which is the states leading to disease. And that is what is often, the information not delineated from animal studies. So having an understanding of how different networks or cellular processes are perturbed, coupled to what we call systems toxicology, whereby we look at the gene response, the protein response, and metabolic response, we can then put together a total picture via various computational and mathematical modeling approaches. So here is an example, and there's a lot of detail on this slide, so I'll talk you through it. So at the start of this toxicity pathway, you have an initiating event. Okay? That is, in this case, receptor activation. That then leads on to various perturbations in terms of cellular processes, which then leads on to mucus hypersecretion, which is a feature in asthmatics, leading on to disease. Now, this is the black box that I'm talking about here. Okay? And this is essentially what you can target with various in vitro studies. Okay? So in theory, if you see no biological elicitation of responses in high content screening, focusing on various cellular endpoints here, and if you see no responses in terms of the 3D lung model, which focuses on these endpoints here, then in principle it shouldn't then move on to the disease endpoint. And essentially that is how TT21C approach targets the adverse outcome pathway. So to conclude, human relevant in vitro studies, including high content screening, high throughput systems, and systems toxicology, support a TT21C approach by giving us a more detailed and mechanistic understanding of the various states that leads on to disease. And it can be coupled to various clinical studies. And currently, Imperial Brands are developing, publishing, and utilizing TT21C in conjunction with other approaches to support this weight of evidence approach in the assessment of ENDS products. So I'd like to finish off there by acknowledging the people that actually did the work and our external partners. And for more information, you can visit our website. Thank you very much.